Hi, my name is Tristan and I would like to speak to you about dependent personality disorder. Dependent personality disorder was first described in 1945 in a War Department technical bulletin. It was established by Abraham and it was based on Freud's description of people that fail to complete the oral stage of development. The American Psychiatric Association recognized the disorder in 1952 with the publishing of the DSM-3. It was originally published as a form of passive aggressiveness, but later fell as its own disorder. The symptoms of the disorder as per the DSM-5 are has difficulty making everyday decisions without an excessive amount of advice and reassurance from others, needs others to assume responsibility for most major areas of his or her life, has difficulty expressing disagreement with others because of fear of loss or support or approval, has difficulty initiating projects or doing things on his or her own, goes to excessive lengths to obtain nurturance and support from others to the point of volunteering to do things that are unpleasant, feels uncomfortable or helpless when alone because of exaggerated fears of being unable to care for himself or herself, urgently seeks another relationship as a source of care and support when a close relationship ends, is unrealistically preoccupied with fears of being left to take care of himself or herself, and these are 8 symptoms. However, a person must have at least 5 of the symptoms to actually be diagnosed with dependent personality disorder, and the symptoms must be chronic. Temporary does not qualify a person as having dependent personality disorder. Now, the prevalence rates for this disorder are 2.5% of the population has dependent personality disorder, while 14% of people with other disorders also have it. However, the possible true rates of the disorder, including the people that have not been diagnosed, ranges from 2% to 55%. Now, the form of treatment for the disorder is only therapy. However, medication for extreme anxiety or depression may be given to individuals that actually need the medications. The forms of therapy include psychodynamic therapy, cognitive behavioral therapy, and interpersonal therapy. Interpersonal therapy is the best of the 3 types of therapy, and it is specifically geared towards people with dependent personality disorder. The first step of therapy is an assessment to determine the causation of negative emotions. Once that causation has been established, the following sessions will be to address the concerns, learn how to adjust, and apply the adjustments to daily life. The therapist may help the process by adding clarification to the issues, giving supportive listening, and allowing communication analysis. Now, the best component of this form of therapy is that it addresses specific issues and is effective with minimum time requirements when compared to other treatments. Now, for this therapy to actually work, patients must be completely honest in regard to their anxiety or depression, and they must be honest about the extremity of their anxiety and depression. That way, the therapist can actually identify causations and the treatment can be geared towards the individual. Now, I'm going to say this. If you have dependent personality disorder, or you think you may find that you are dependent on other people, seek help. It's nothing to be ashamed of. There are more people with the disorder than what we actually think. And if you ever feel like you are at that state of hurting yourself or hurting someone else, call 911. It's better to be safe than to be sorry, and don't be afraid.